Hello everyone and welcome. I am Dr. Masood Khan and today's our topic of discussion is gold strategy for chronic obstructive pulmonary disease. The latest guidance updates it includes cessation of smoking, and there is a lack of evidence to support e-cigarettes as a smoking cessation tool for people with chronic obstructive pulmonary disease. Number two update in this 2024 gold guidance is respiratory syncytial virus vaccination is now recommended for individuals with COPD who are aged more than 60 years or have long-term heart or lung disease or immunosuppression like lymphomas or post-chemotherapy status. Greater emphasis is placed on ensuring that patients use inhaler devices correctly and are given a suitable device. In the full guideline, sections on hyperinflation, interstitial lung abnormalities, blood eosinophil count, and screening in targeted populations have been added or expanded. Now, key takeaway from the guideline. The key takeaways from the guideline. The 2024 goal strategy still uses the definition of COPD proposed in 2023, which focused on the conditions, chronic respiratory symptoms, and the abnormalities of the airways that underlie them rather than on its causative factors. The most common symptoms of COPD are dyspnea, cough, sputum production in up to 30% of patients, and recurrent lower respiratory tract infections. Less specific symptoms include wheezing, chest tightness, fatigue, and weight loss. A diagnosis of COPD is confirmed by the presence of symptoms and irreversible airflow limitation with a postbronchodilator FEV1/FVC ratio of less than 0.7 on forced spirometry. Gold advocates a combined approach to the assessment of suspected COPD, incorporating spirometry, validated questionnaires, and exacerbation history. Classification of disease severity is based on a composite of the impact of disease, exacerbations, comorbidities, and lung function. Since 2023, Gold has used a new ABE classification system that recognizes the impact of exacerbation frequency. Maintenance and prevention strategies for COPD aim to reduce symptoms and risk and enhance exercise tolerance and health status, and consist of stop smoking interventions, vaccinations, and reducing exposure to air pollution and other irritants. The management of stable COPD comprises tailored pharmacological and non-pharmacological therapies, complemented by training in device use, assessing adherence to treatment, and evaluating response to treatment. Gold recommended initial pharmacological treatment consists of a bronchodilator for Group A patients. So the Group A patients consist of a bronchodilator. A LABA plus a LAMA for Group B patients, and a LABA plus LAMA for Group E patients with the addition of an inhaled corticosteroids. If blood eosinophil count is more than 300 cells per microliter, as needed SABA use improves FEV1 and symptoms and is recommended for all patients. So the ABE, A we can use SABA that is the reliever, and it can be used in group B patients as well and in group E patients as well as when required. In the group A patients, LABA plus LAMA. Group B patients, LABA plus LAMA. And group E patients, LABA plus LAMA plus ICS. So, in combination therapy, use of a single inhaler is preferred over multiple inhalers. The choice of a particular inhaler should be made in line with the principles of shared decision making. The patient's preferences and ability to use the inhaler are essential considerations. If response to treatment is poor, follow-up pharmacotherapy involves assessment of adherence and inhaler technique, and if symptoms remain, escalating therapy or switching device or drug molecule. Initial non-pharmacological therapies for COPD are divided according to A, B, E category, consisting of smoking cessation in every COPD patient, a good exercise, and vaccination for all groups, with the addition of pulmonary rehabilitation for Group B and Group E patients. Routine follow-up of COPD is recommended, involving review of symptoms, exacerbations, smoking status, adherence to therapy, efficacy of treatment, and lung function. Gold advocates treating exacerbations with short-acting bronchodilators, systemic corticosteroids, antibiotics, and non-invasive mechanical ventilation as appropriate. The red flags for hospital admission include worsening symptoms such as declining blood oxygen saturation, acute respiratory failure, new signs such as cyanosis, and serious comorbidities such as heart failure. In the end, COPD stands for chronic obstructive pulmonary disease, FEV1 for forced expiratory volume in 1 second, FVC for forced vital capacity, and the GOLD Global Initiative for Chronic Obstructive Lung Disease. ICS inhaled corticosteroid, LABA long-acting beta agonist, LAMA is long-acting muscarinic antagonist, and SABA is short-acting beta 2 agonists. So these are latest guidelines of GOLD 2024, the updates. Thank you very much.